for today's lecture is about the biological effects of radiation and the risk evaluation from the radiation exposure. We are starting on a new chapter. So the topic that we will be learning today is the mechanism of biological damage, how the radiation can damage our biological systems. We will also discuss about the factors that can affect the biological damage. And we will look at these factors individually, which involve the radiation dose, the dose rate, the linear energy transfer or the type of radiation, the type of tissue involved, the amount of tissue, the rate of cell turnover and the biological radiation, and also the presence of certain chemicals. Okay, so the first thing which we are going to discuss is the mechanism of biological damage, and this figure is given in your book 15.1, and as you can see there is a series of steps involved in the mechanism of biological damage. The first step is the deposition of energy. By the deposition of energy is the energy which is deposited by the radiations in the form of ionization and excitation of the atoms or molecules of the biological system. So in this first step there is a series of events in the deposition of energy, and this deposition of energy is basically by the radiation in the form of ionization and excitation of different atoms or molecules in the biological system. This step generally lasts about 10 to the raised power minus 12 seconds or less than that. The second step is the transfer of energy. It can be intra or intermolecular to produce the radicals. So this step, first of all, the second step is a very important step because this step will cause the radicals to form. And in the human body, these radicals will be H and OH because the human body constitutes 75 to 85% of water. That's why in this step there will be the formation of H and OH radicals. So the duration of this second step will be from 10 to the raised power minus 12 to 10 to the raised power minus 3 seconds. And there will be energy transfer that can be either to the neighboring molecules or to the molecule itself. That means intermolecular or intramolecular, to form various short-lived and chemically active species which are called the free radicals. So in the human body, because the water constitutes 75 to 85% of the mass of a living system, the most of the ionization produced in the water will be in the form of most two common radicals, H and OH. The third step is the chemical reaction of radicals. So in this step there will be the interaction or alterations by the free radicals of our biological system, and it can be alteration or of the biomolecules, for example DNA and RNA, to produce alterations in them. So first of all, the duration of this next stage will be from milliseconds to several seconds, and the free radicals which were formed in the previous stage will react either among themselves or more significantly with other important biomolecules, for example the DNA and RNA, to produce the alterations in them. And reactions of these free radicals with the most important biological molecules will cause the most radiation damage which are observed in the living system. The final step is the expression of these biological alterations produced in the third step. So first of all, the fate of these altered biomolecules, the expression of these altered biomolecules, it depends on the type and the function of the altered molecules, and also on their repair capacity, that how will they repair if they are irradiated biological systems. So the expression of these biological alterations can be eventual or they can be manifested within a short time, or they may be delayed up to the several generations depending on the type and the function of these altered molecules. So that's how the damage to the biological system happens, and there are various steps involved in the mechanism of the biological damage, which I have summarized already. The first step was a deposition of energy, and this deposition of energy was by the radiations in the form of ionization and excitation of different molecules and atoms. And then the transfer of energy, which was the second step, and it can be intra or intermolecular to produce the free radicals. And in the living systems, it will be by the radiolysis of water, and they will form two most common free radicals, H and OH. The third was the chemical reaction of the radicals, in which these free radicals will alter the biomolecules, for example the RNA and DNA. And the final step was the production and expression of the biological damage. So this depends on the type and the function of the biomolecule which is altered by these free radicals, and it can express eventually, or it can express in a short period of time, and it can be delayed to the several generations. Okay, now we will talk about the factors which can affect the biological damage. So the first thing is the radiation dose. As we already know, we know it very well that generally we say that more effects are associated with higher dose, and less effects are related to the low dose. So the exact relationship of the dose to the effect produced depends on the nature of the effect, and this dose effect relationship for the either for the induction of the cancer or either the genetic mutation, it differs. So depending on the dose effect relationship, the radiations are termed as stochastic or deterministic. And in the deterministic effects of radiation, we know that there is always a threshold level to produce any effect, while in the stochastic effect we do not have any threshold level to produce the radiation effects. So what happened in the stochastic effect, the probability of occurrence and not the severity of the effect depends on the radiation dose, and it depends over the period of time. These, if in a human being the radiation is given over a period of time, there can be induction of cancer or there can be genetic mutation. Two important examples of these stochastic effects, as I have already mentioned, these are induction of cancer and the genetic damage, whereas the probability of induction of cancer is higher as compared to the genetic damage. And stochastic effects do not have threshold. That means there will be zero occurrence. There is a probability of the occurrence of effect is zero. So the stochastic effects, in stochastic effects, the radiation protection is our major concern, and we assume that the risks from the radiation are directly proportional to the dose without a threshold. That's why this assumption forms the basis of our Alara principle. While if we talk about the deterministic effects, just remember that the severity of effect depends on the radiation dose, and it has a threshold value. So below this threshold value, there will be no effect observed. And the two most common examples of deterministic effects of radiation are production of cataracts and erythema. Next is the dose rate, and just remember that the linear energy transfer, as we know that the linear energy transfer of any energy is the measure of amount of energy transferred locally by a charged particle to the target atoms in its immediate vicinity of its path traversing a small distance to the distance dx. So the dose rate basically by the to the two identical biological system by the radiations with different linear energy transfer will be different, although high dose rates are more damaging than the low dose rates. Now we will talk about the linear energy transfer or the type of radiation. So just remember that the alpha particles and the protons, these are absorbed and they produce greater damage in the biological system as compared to the electrons and gamma and X radiation. So higher linear energy transfer radiation, for example alpha particles and protons per unit of absorbed dose, will produce greater damage in the biological system than the lower linear energy transfer radiations, which are electrons and gamma and the X-rays. I have already told you about the linear energy transfer, which is the energy transferred locally to the distance traveled to the target atom. Okay, now the relative biological effectiveness of a radiation for producing a given effect in a biological system can be defined as the dose of a standard X-ray radiation needed to produce the same biological effect by the dose of a second radiation needed to produce the same biological effect. So this is known as relative biological effectiveness. So just remember that the effects produced by different radiations to the same or the identical biological systems will be different regardless of the radiation dose administered. अगर आप सेम बायोलॉजिकल सिस्टम्स के अंदर सेम अमाउंट में रेडिएशंस दे रहे हैं और आपके पास रेडिएशन की टाइप डिफरेंट है, then there will definitely be different effects. There will be no same, you cannot observe same effects with different radiation of different linear energy transfers. The next important factor is the type of tissue, and we know that biological responses vary widely depending on the type of tissue. For example, if it's liver, bone marrow or nerve tissue. So the bone marrow is much more sensitive than the nerve tissue for certain types of radiation damage, and we have discussed it already. The next factor which is very important is the amount of tissue. So injury to a biological system depends on the amount of tissue irradiated. For example, there will be more effects if the whole body has been irradiated as compared to a specific part. So the mammals can tolerate a much higher dose to a part of the body than irradiation of the total body. There will be more effects if the whole body is irradiated, if the whole body is given more radiation dose as compared to a specific part of the body. Although it depends on the sensitivity of the irradiated part as well. The next factor is the rate of cell turnover. The rate of cell turnover is basically, it refers to the speed of constant shedding of a dead cell and the replacement of this dead cell by the healthy cells. So the rate of cell turnover in tissues is deemed to affect the latent period for the expression of tissue damage. For tissues with a rapid cell turnover, for example the bone marrow, damage to occurs earlier than for a slow cell turnover, for example liver. The last factor is the biological variation, and the response of a biological system with other factors constant may vary enormously among the closely related individuals. One person may survive a total body dose of 400 rad, whereas a dose of only 200 rad in another person may be lethal. So there can be biological variation depending on the response of various responses by the human body. There is another factor which is the chemical modifiers, and in the presence of certain chemicals, these certain chemicals can modify the responses of biological system to the radiation. Substances that make the biological systems more radioresistant are called the radioprotectors, and a good example of a radioprotector is the protein cysteine. And the substances that make the biological system more radiosensitive are called the radiosensitizers. And an example of a radiosensitizer is molecular oxygen. And for them to cause any effect in the human body, their presence in the biological system during the radiation is important. Now we will talk about the equivalent dose and the dose equivalent. The equivalent dose is basically the biological because biological effects per unit absorbed dose in a tissue are dependent on the type of radiation, which can be X and gamma ray versus the proton and the particle. We use a weighing factor, which is WR, which is known as the weighted dose or the equivalent dose. To distinguish it from the absorbed dose, it is given in rem. So the difference between the equivalent dose and the dose equivalent is of only unit. We express equivalent dose in rem while we express the dose equivalent in different unit. So this is the only difference between these two doses. The equation to measure the equivalent dose is given, which is H denoted in rem or sievert, equals to the weighted factor, which is the weighted dose, into the D, which is the absorbed dose. The weighted factor is equivalent to 1. Therefore, the dose D and the equivalent dose H are the same in amount, but they only vary in units, rem versus rad. So we use rad for the absorbed dose, and we use rem for the equivalent dose. This is the only difference. And the quality factor, the radiation quality factor or the weighting factor used in dose equivalent is QR, which is also equal to 1, just like the weighted factor used in the equivalent dose. Okay, now we will talk about the deleterious effects in the humans, and we know that there can be acute effects and there can be late effects. So the acute effects, depending on the dose range or the dose or the dose deposited or the energy deposited by the radiations in the human body. There can be no effect, there can be mild damage to the bone marrow, there can be severe damage to the bone marrow, mild damage to the gastrointestinal tract, and there can be severe damage to the gastrointestinal tract and damage to the central nervous system. This is a very important table given in your book, and you should know the dose ranges. So there will be no effect at 0 to 200 rad, usually unobservable symptoms. At 150 to 400 rad, there will be transient nausea and vomiting, some evidence of damage to the hematopoietic system, and they can be recovering in the 1 to 2 months, depending upon the stages of the radiation responses. We already are familiar with the stages of the radiation responses. At 350 to 600 dose range, there will be severe damage to the hematopoietic system. Bone marrow transplant is essential, and the survival chances are moderate. At 550 to 1000 dose range, there will be gastrointestinal damage, severe nausea, vomiting, diarrhea, and there will be a very small chance of recovery, and the death follows in 10 to 24 days. And at 1000 and above dose, there will be confusion, shock, burning sensation, and death follows within the hours. So these can be the acute effects depending upon the dose range. Late effects, we do not have much data on the late effects, because it was very difficult to follow up the patients, and also there were very few we had very few people involved in the in our population, our targeted population to study, and the data that we have retrieved from different population, we basically categorize different people, and those people were the radiation workers, those who witnessed the Nagasaki and Hiroshima atomic bomb explosions, and also we have data from the laboratory animals. So that's how we have categorized our data from the late responses, and we have observed all of the data, and what we have concluded from this is that from all these late effects, the induction of cancer and the genetic damage are the most important ones, and the lifetime risk of a fatal cancer of any type from a single uniform exposure to the total body, it depends upon the age at the time of the exposure and the dose rate. And there is an estimation of present estimation that if we double the dose, then there will be double chances of genetic effects, and there is a range of these doses as well for the risk of fatal cancer. In general population of all ages, the risk of fatal cancer is 10 to raised by minus 4 m, and in the working population 18 years and older, there is a risk of fatal cancer of 8 into 10 to raised by minus 4 m. These are the high doses and high dose rates I am talking about. In the low dose and the low dose rate in the general population of all ages, the risk of fatal cancer can be 5 into 10 to raised by minus 4, and in the working population it can be 4 into 10 to raised by minus 4. Now the effects of the late effects, basically we know कि ये आपके पास ओवर द शॉर्ट पीरियड ऑफ टाइम भी हो सकता है, और हो सकता है कि ये आपको कुछ टाइम में ही सिम्टम्स शो होना शुरू हो जाएं. हो सकता है कि कुछ बहुत ज़्यादा टाइम लगे, इट कैन टेक अ ईयर और 2 years फॉर द इंडक्शन ऑफ अ कैंसर, या हो सकता है कि आपको जो पेशेंट है उसको फ्रैक्शन ज़्यादा मिल रही है, डोज की हाई डोज मिल रही है, और वो थोड़े ड्यूरेशन में विद इन 6 months he or she has started to show symptoms. So we do not basically have a threshold value, but we do have we can say कि हमारे पास एक डोज की रेंज ज़रूर है कि अगर हाई डोजेस मिल रही हैं पेशेंट को तो हो सकता है वो जल्दी ओवर अ पीरियड ऑफ टाइम सिम्टम शो करना शुरू हो जाए, बट अगर एक पेशेंट को लो डोजेस मिल रही हैं तो डेफिनेटली he or she will take much time to express symptoms, but ultimately the late effects will occur, and these late effects will be in the form of induction of cancer or genetic damage. The last topic which we will talk about is the radiation effects in the fetus, and we know that there is a most sensitive stage for these effects to be produced, and these effects can cause abnormalities, and this time period is between 3 to 15 weeks after conception. And the most common abnormality in humans occurs in the central nervous system, the mental retardation. Radiation studies of rodent during this interval suggest that doses as low as 5 rad may produce gross congenital malformations, and below 5 rad the main risk to a fetus is the increased probability of cancer, which at present is estimated to be 2 to 3 times that of an adult. So when there is a period of organogenesis, the fetus is at high risk of developing the radiation effects, which can be related to central nervous system. or different congenital malformations. So that's all for today. If you have any questions regarding this lecture, then you can ask. Thank you.